So my name is Rachel Harold. I'm an infectious disease physician in Washington, D.C., and very proud to be a part-time consultant for the Medical Society Consortium on Climate and Health, and very thrilled to be part of the sessions this morning. So this morning we have two really special sessions. Again, as I mentioned, they're eligible for continuing education credit. So you can find the link and instructions for claiming those credits in the annual meeting program and on the website. So that will show you how to get credit for these special sessions. After these two sessions, there'll be a break until 2 p.m. when we resume for very exciting afternoon policy sessions. While we're doing these sessions, please be mindful to keep yourself on mute during the session while our speakers are presenting. But as I mentioned, at the end, there'll be some time for questions and answers where you can unmute yourself and we can have a nice discussion. And also feel free to put questions in the chat box, and I'll be keeping an eye on those. So first up, we have a wonderful session with Dr. Rosencranz and Dr. Ramkumar on incorporating climate change into medical education. So just quick introductions for these wonderful presenters. So Dr. Japhia Ramkumar is a board certified internist and clinical associate professor at the University of Illinois, Champaign-Urbana in the College of Medicine. Also an associate professor at Carle, Illinois College of Medicine and American University of Antigua. Dr. Rosencranz is a board certified internist with over 30 years of experience in clinical medicine and medical education. She trained at the University of Illinois at Chicago and is now a fellow of the American College of Physicians. Both are very active in developing medical school curriculum and educating the medical community locally, nationally, and internationally on the topic of climate change and its health impacts. They're both founding members of the Illinois Clinicians for Climate Action, and they're both master gardeners, both deeply passionate about human and planetary health. So I'm thrilled that they're going to share with us some of their experiences in incorporating climate change into medical education, especially through clinical simulation. So Dr. Rosencranz, Dr. Ramkumar, thank you so much for being here, and I'll turn it over to you.
Thanks so much. We'll start with slide one, our opening slide, and I just want to say greetings, everyone. Thank you for that lovely introduction, Rachel. I'm Holly Rosencranz. My colleague, Japhia Ramkumar, and I are delighted to be here today. The introductory remarks last night were so inspiring, and we're honored to participate in this consortium's annual meeting to learn from like-minded individuals and share our own journey, and then hear from you folks. We're going to talk about how we've incorporated climate change into our medical school curricula and our vision to continue to do so in a variety of formats. So as Rachel said, we're both internists from the University of Illinois and share this passion for human and planetary health. Our educational pursuits fit the theme of this conference, the medical promise of climate solutions, moving to action for health and equity. So we hope to be part of that solution by providing inspiration for the development of further engagement and instructional activities for our trainees and medical community to learn about and address all sorts of environmental risks. So slide two, our objections are shown, and what we'll describe are some of the challenges we encountered and show how we developed a variety of educational strategies and how we assessed our projects. But our mission in the next 30 minutes is to share 5 years of this journey with you and inspire others to create strategies at their own institutions using resources at hand. And we know that many of you are already doing this, so we're really excited to hear from you later. Next slide. So over 10 years ago, the World Health Organization stated that climate change is the greatest threat to global health in the 21st century. And since then, the imperative to train climate-aware and active physicians has also been expressed by our medical societies. And just two examples are the AMA and our own internal medicine society, the American College of Physicians, shared statements supporting this imperative, and specifically educating the medical community on health importance of climate change so they can project that education to their patients and to the community at large. Slide four. The attention on medical schools training doctors on climate change goes beyond the public health and medical organizations. Here, the Wall Street Journal, a business journal, was pointing out that medical schools need to adapt and change their training programs. Slide 5. And beyond training health professionals, multiple medical societies endorse collaboration with education of patients, businesses, communities, and government to mitigate this public health crisis. Next slide. We have found that the reality is that actually few medical schools are teaching this in a sort of robust and regular fashion. So slide 7. The good news is that since we began this journey about 5 years ago, there are some very robust and creative programs, and more are emerging, from quality improvement projects, single courses, to fellowships and clinical electives. So by sharing our experience, we hope to spur more medical school offerings and training on climate change. And just to once more acknowledge that many of you are already working with trainees to incorporate climate and climate education. And again, we're really looking forward to sharing your work and ideas at the end of the session. So next slide. Starting with the challenges, our research revealed that one of the main barriers to incorporating climate change is these competing content priorities. Everybody wants a piece of the curriculum. So how do we add content to this packed curriculum and without taking away essential content? So additionally, our own experience revealed that there's challenges with scheduling, buy-in from faculty, and even concerns about political overtones. Next slide. So Japhia and I began our journey in 2016, and this is when I partnered with a medical student to deliver a one-time lunchtime lecture to other students. They were enticed by a pizza lunch. Food's always very great enticement, and it was part of a leadership certification program. So there were some added incentives. And this was a great example of adding content to existing content. And the students were so engaged and interactive. It was really quite inspiring. So fortunately, this poster, got the attention of my colleague, Japhia, who has since become my wonderful partner in this journey. Next slide. So after seeing this poster, we realized that we had a shared passion and vision and a desire to impact the education of our trainees. And this gave birth to this idea to find ways to add content to existing curriculum with the added element of an active learning element. So this active, and Japhia was just so well positioned to do so, and she'll tell you more. She'll tell you quite a bit about this with her work in simulation. Next slide. So we began our journey. Here's a map of what we've done, from starting with evaluating our own institution back in 2016, to a trial of simulation exercise with medical students, to developing a standardized patient case. By the way, I will say SP periodically, that means standardized patient. And to develop a standardized patient encounter suitable for student instruction as an OSCE, and I think some of you are familiar with that term, that observed structural clinical exam, that's a standard part of our instructional process. And we studied our results and we published them. And then we moved on to broadening our impact with addressing the syndemic of climate change and COVID, when COVID came onto into our world. And that led to introducing policy training. And so now we're part of an ongoing regular occurring medical colloquium at our school. We've also developed an independent study, a medical school elective, and our journey continues. So to take you through the steps, I'm going to turn this over to Japhia, who will further explain our journey.
Next slide, please. Good morning. Hello. Is there feedback? Hello, I'm Japhia Ramkumar, and I am thrilled to be here with you to continue to share our journey. And as director of the Clinical Simulation Center, it had occurred to me that we should use simulation, which is a well-regarded tool in medical education, as a vehicle to incorporate climate change into the curriculum. It was our resource, and I was well positioned to do this. And for us, simulation exercises weaves through every year and touches all our clerkships. So it just seemed like it would be a great jumping point to insert climate education into the curriculum for us. Now, in our simulation center, our focus is on simulated encounters with standardized patients. And in my role, I write these clinical case scenarios and the scripts that the SPs use to portray a patient with a clinical problem. I create the medical and the character profile, and I pay particular attention to the backstory. this all-important backstory that you're going to hear me mention as we go on. And what we do is we work hard to include varying social determinants of health to create a more fulsome character, the kind of backstory that makes that SP come to life. So for example, in one of our second-year cases, which is that of a patient with unexplained weight loss and jaundice, the character profile or the backstory of that patient is that they live in Clinton, Illinois. They're married with 3 adult children and 2 grandchildren. They're non-smoker, drinks alcohol moderately, works as a maintenance supervisor at the Clinton nuclear power plant with a lot of responsibility, has good medical insurance. Their spouse is an organic farmer, and they love eating healthy, and they love eating their own produce that they grow. Their hobbies include fishing on Clinton Lake and riding their Harley motorcycle. So it gives this picture of a real person with real life experiences. And we thought of creating SP scenarios where we expanded on the social determinants of health to include environmental determinants of health and incorporate climate risk and exposures to create a climate backstory. As we know, these are the factors that impact a person's capacity for adaptation and mitigation. Next slide, please. So one of our first, I'm sorry, can you go back? One of our first initiatives in keeping with the idea of simulation was to deploy a workshop in which we asked the students to create a rudimentary SP scenario. So this was a very loosely structured workshop, and the students were instructed to basically choose a climate threat, and using the lens of climate change, the students had to consider multiple risk factors and vulnerabilities to create patient scenarios, and then come up with recommendations for their patients to mitigate these risks. And I confess that we had some concerns when we deployed this task. These were M1 and M2 students, and we had some concerns. Were they prepared to develop such cases? Now, we had given them a single didactic lecture in advance, but even then, we didn't know if the students had the background or the knowledge base to create a meaningful scenario. Next slide, please. Next slide. Yes, thank you. And we were just amazed by the results. The students just came up with these tremendous scenarios, cases that range from an adult with exposure to wildfire, which turned out to be a springboard for what we did later, a child with reaction to mold from flooding after extreme storms, and an adult with anxiety following destruction of her home after a hurricane. They got it. They made the connections. And the discussion that ensued was wide-ranging and robust and blew us away. The students talked about local mitigation strategies, and what really got us excited was that they were talking about the big structural changes needed to tackle climate change, such as transitioning to clean renewable energy, stopping deforestation, all the things that we taught that were mentioned in yesterday's session. They totally got it. We were so excited and motivated by this outcome. Next slide, please. So armed with that success, we wanted to build a better mousetrap and created more structure and provided this mini template for the students to work from, and actually assigned climate threats like heat, air quality, vector and waterborne diseases, and extreme weather. Next slide. So this structured mini template gave detailed guidance on building a case from the chief complaint through the history of the present illness. We had options for physical exam and treatment, but these were early learners. These were preclinical medical students. And so really we wanted the focus to be on the historical aspects of this case scenario. Next slide. We used a typical history and physical format with an emphasis on including vulnerabilities and social and environmental determinants of health to create this patient profile and the all-important backstory. And additionally, we wanted the students to include in their impression and plans strategies for adaptation and mitigation for their specific climate threats, thus going beyond traditional individual treatment plans. Next slide. So buoyed by our great feedback, by the great feedback and enthusiasm, and motivated by the students' ideas, in particular, the wildfires that were raging in California at the time, we decided that it was time to create our own fully fleshed out SP case scenario. We did this with the intent of incorporating it into the regular simulation exercises at our institution. And we write this case scenario using our standard simulations center case template from the University of Illinois. Next slide. So that's what you're looking at, the case template. And you may recall I talked about the backstory of the unintentional weight loss that I talked about earlier. Well, in this new case scenario, clinical case scenario that we developed, asthma exacerbated by wildfires raging in California. The backstory was that of a retired office worker from California who's exposed to ongoing wildfire smoke that's like 200 miles away, which is worsening her asthma. This patient has a limited income, is unable to relocate, has significant financial concerns regarding paying for medication, let alone the ability to provide retrofits for a home, such as sophisticated HVACs and air filters. I mean, whoever thought about or learned about that kind of stuff in medical school, right? So we decided we wanted to run a beta test to see how our students would respond to this kind of SP case scenario. We recruited several senior medical students to run through this clinical scenario, trained an SP with the script, and again, we were just blown away by the response, which was robust and spurred just tremendous conversations where the students shared a lot of personal experiences. So for example, one student shared a compelling story of actually having to evacuate from their home in California due to rapidly encroaching wildfires. And so this was really close to hope for this student. And the student recognized the importance of having future physicians learn about these emerging threats. Another student admitted that they had never thought about making the connection between climate change, environmental exposures, and asthma. And this student wanted to go on to do pediatrics. And asthma is such a common problem that they see in the pediatric age group. And so now they would absolutely consider this in caring for future pediatric patients. Next slide, please. So these simulation exercises require faculty facilitators. So it therefore required us to provide them with some sort of debriefing guide. And so we developed a debriefing guide, which provided background information regarding specific health threats to climate change with a focus on this case on air quality and strategies for mitigation. And we also provided the most recent asthma management guidelines, keeping within the traditional pedagogy of this type of exercise. The response of faculty was also very positive. They even provided additional ideas for case scenarios that could be used in other specialties. So example, low birth weight due to poor air quality and heat stress for OB-GYN faculty, or depression and anxiety due to loss for psychiatry faculty, and so on and so forth. Next slide. So here we are at the Alliance for Academic Internal Medicine Conference. And this is where we presented a workshop guiding the participants, who are largely medical educators, to build their own case scenarios using a template very similar to the one we used with our students in previous exercises. This time we thought we'd get faculty to do this. Next slide. So the faculty were given climate threat prompts, the same ones that we had given the students: heat, air quality, vector and waterborne diseases, and extreme weather. They then connected the common chief complaint to the assigned climate exposure risk, came up with a diagnosis, and then worked backwards to develop a case scenario, sort of reverse engineered that case scenario from the diagnosis. And the point being that they could take this initial iteration of a case and further develop it and use it at their own institution. We provided them with some additional tools for the case development, such as this CDC wheel and the sheet and a list of threats and health impacts that you're looking at right there on your screen. And in addition, a short synopsis of our wildfire case as a guide. Next slide. So a real milestone in our journey was when we incorporated this wildfire asthma case in the M3 internal medicine rotation in their OSCE, the objective structured clinical exam, which is a core component of medical student training nowadays. And here we were able to add content to existing core content. And the core competencies of history and physical exam and understanding a commonly encountered medical condition, reactive airway disease, were all covered, but through the lens of climate change impact. And so we talked about masks and monitoring air quality indices and other non-traditional recommendations that go way beyond the prescription. Next slide. Next slide, thank you. We deployed this in a group setting and in an individual typical one-on-one setting. And just so you know, we do send the students material in advance that includes some information on health impacts of climate change as part of their prep material. So they don't go into this blind. Next slide. So naturally, we wanted to study the impact that this OSCE had on our student. And we used a Likert and qualitative surveys to assess the impact. Next slide. And we were so gratified to get feedback from our students, which reflected one, increased knowledge and awareness of the health impacts of climate change, and significantly, the importance that they recognize the importance of being climate aware providers who could include this climate education for their patients and mitigation and adaptation strategies in their management plans. Next slide. So we then searched the literature to see if there were any simulation cases that included anything on climate change. And we could find nothing. We could find no such cases. So we thought that we wanted to publish our case and share this with a wider audience. And we did this. We published our work in the Association of American Medical Colleges, AAMC's MedEd portal. And we can provide you with the link to this case, and you can see all our material, including our surveys and data and references. Next slide. We continued on with our case building workshops and continued to enjoy the creative and inspiring scenarios that our students always come up with. Next slide. And then COVID happened. And it was so clear how inextricably linked the health of the planet is to the health of humans. And we were struck by the overlap of the shared drivers and the potential solutions that address both the climate and pandemic crises. Next slide. And we recognized that it was essential to talk about this interconnectedness and identify the overlapping and the disproportionate impacts of climate change and COVID-19 on vulnerable communities who are already suffering from poor health, and to incorporate these social and environmental determinants into new workshops. And so we described these new workshops. We described a new workshop on the syndemic of climate change and COVID-19, and adjusted our instructions to build cases in which the students had to navigate this new world in which the health of their patient and the planet is interconnected, and the solutions require education and awareness of all these elements. Next slide. And we developed a new worksheet to incorporate these principles in the case scenarios, and that's what you're looking at right here. Next slide. Well, again, naturally, we wanted to study the response to this new workshop through surveys. Next slide. And again, we were very pleased to see a positive response to this particular approach. Next slide. And we actually presented our findings in a poster at the annual conference for the National Council for Science and Education just this last January. And one of the conclusions was that we can go to the next steps in training providers to be effective educators and, more importantly, advocates on personal and planetary health in the context of both climate change and COVID-19. And so this is where we decided to shift gears to focus our journey into advocacy and policy training. And I'm going to turn it back to my colleague, Holly, to tell you about this part of our journey. Thank you so much.
Holly, I believe you're on mute.
You're muted.
Sorry, thank you. And thank you, Japhia. You've been hearing about one type of active learning exercise, which is guiding students to make connections between climate change and health through developing cases that incorporate climate risks and vulnerabilities into standardized patient case scenarios in their existing curricula. And these activities have been great examples of adding content to existing content. Now we're building on these patient simulation exercises with the goal of developing competencies in line with the mission of this medical society consortium. The mission is to seek physicians in every community in America willing to become advocates for climate health, using their voices to speak to local policymakers, local press, and community groups. So Japhia and I recognize that medical students are the next generation of healthcare providers. Last night in the greening talk, we were reminded that healthcare providers remain very respected voices. And these students will be future role models and agents of change, and they'll have a powerful voice in addressing environmental health issues of the day and weigh in on policy matters. So this led to the idea to expand our workshop options or even the OSCE impression and plan part of the OSCE into exercises that would give the students the tools to proceed with advocacy and policy engagement to promote individual and community health. We really wanted to empower these future leaders to address environmental health issues. And so that really was the next step in the planning of what to do and how to proceed with patient care. So next slide, I'm going to describe these other workshop formats with the advocacy theme that we developed, and we're now actually expanding. So in one setting, students were assigned 2 cases of patients impacted by climate change. They were tasked with approaching individual treatment, but they were also asked how they would go further with the patient visit. Specifically, they were directed to suggest actions they would take for these patients at the local healthcare facility and community level to address the regional and environmental conditions that were threatening health. Next slide. So the case study examples of patients impacted by climate change were as follows. A migrant woman with depression related to profound loss from extreme weather, and a young child suffering from severe allergy and asthma symptoms related to high pollen counts in polluted air. In addressing their treatment, we wanted them to think beyond that individual inhaler or antidepressant. Next slide. So these students were instructed to take a deeper dive, and we asked them how they would use their own voice to protect the patient in their community. So once again, using simulation, they were asked to prepare to educate healthcare institutional leaders and policymakers at a local public hearing.
You're on mute again.
Somehow you got on mute again.
I'm sorry. Oh, gee, I don't know why. I'm sorry. So again, this is slide 38. I'll just start over. The students were instructed to take a deeper dive into the learning exercise, and we asked them how they would use their own voice to protect their patients in the community. And so we used simulation again, and they were asked to prepare and educate a healthcare institutional leader and policymakers at a local public hearing dedicated to developing a climate action plan. And what was really entertaining, we actually had a faculty member pretending to be the mayor, and we actually had one of the hospital administrators who was a physician as the CEO of the hospital. And this was a really engaging exercise. So in the instructions, students identified the research they would do to present testimony, to explain the multiple impacts of climate-related illness, recognize opposition, and determine what points to highlight to convince the policymaker or the hospital leadership to support a position. Again, I just want to focus that there's no political overtones, and we're very careful about that because I know this can be a somewhat polarizing topics. Next slide. Next slide. So taking it a step further, then we have developed a subsequent workshop in which students engage in policy by considering actual real legislative activity. So they examined existing climate-related bills and created a fact sheet for a concise presentation to a legislator, outlining specifics related to economic and health impacts, existing legislation, and anticipated opposition. Next slide. So several current bills before the General Assemblies across the US were used for real examples of timely concerns. Then we use the Illinois Clean Energy Jobs Act, which is near and dear to us in Illinois, the New Mexico Electric Vehicle Tax Credit Act, South Carolina Disaster Relief and Resilience Act, and the Hawaii Tree Planting Program. This approach was nonpartisan. In fact, students were free to express their own opinions and approaches, but we wanted to learn how to do advocacy and policy presentations. Next slide. So instructions were given to develop a policy or advocacy statements and fact sheets, recognizing the very short time people have, as you guys will note next week when the consortium does some legislative activity. And one of the other things that we wanted to really focus on in these instructions were to share their personal stories. So Japhia talked about our medical student who shared the story of the wildfires. And just want to emphasize the power of personal stories. Last evening, we heard some really compelling opening remarks from wildfires of asthma to the plight of the farmers. These are the stories that move policy forward, and it's so essential to be part of policy statements. Next slide. So a worksheet was provided to guide exercises for presentation to a legislator, much like the activities of this consortium. And this worksheet we hope could be used in the future for actual policy advocacy activities at local, state, and federal levels. And I've got the worksheet shown here. It gives prompts for an introduction, the personal stories, the highlights of the bill, how to address the issue through the lens of a public health professional, and how to respond to possible objections, and then a summary statement, all within that short time, of course, that we only have with the legislator. So slide 43. So reflecting on all these experiences, we talked about, Japhia talked about these interactions with standardized patients and thinking about mitigation adaptation, and then concerning adding these elements of policy and advocacy. We have actually developed an independent study elective of medical students called Climate Aware Physicians, in which students will improve their ability to actually diagnose and treat patients. That's their core responsibility, but in the context of climate change and environmental determinants, fulfill their professional responsibilities for community health, but contribute to sustainable healthcare using their voice to promote community resilience and policy advocacy. So the last slide 44, next slide, please. Coming to the conclusion of this presentation, we're thrilled to share our experiences at this annual meeting of the consortium, collaborating again, as I said, with like-minded individuals, seeking solutions to climate change and promoting planetary health. I also want to share that we can contribute to and learn from similar efforts outside the US. For example, we shared and posted some of our learning activities with the Center for Sustainable Healthcare website based out of Oxford, England. And I have to say the UK is a real role model. They've already made exciting commitments to bring its National Health Service to net zero emissions and to expand the training of doctors and other healthcare workers on climate change and sustainability. So just to say, the global medical educators, we have a lot of work, but an exciting journey ahead to address the medical promise of climate solutions. And finally, just thank you so much for your attention. We'll have some time for questions. I just want to emphasize that our take-home lessons are all sorts of clinical simulation exercises can be used to teach core competencies, but they can also enhance other aspects of our education by incorporating backstories that include climate change, related risk and vulnerabilities. And these exercises can be modified to address any other emerging threats or hot button issues, climate justice, the pandemic, shared drivers that impact health, or specifics related to one's own faculty, a specialty. And the exercises can be used as a springboard for the discussion of policy and advocacy strategies to improve community health and encourage our future health care providers to use their voice. Finally, students are just such a source of inspiration. And I think you got that energy from Japhia. Students will continue to inspire your journey as educators. So thank you so much for listening, and we'd love to hear any questions you have.
Wow, Holly and Japhia, thank you so much. What an incredible presentation. I think someone summed it up in the chat best when they said Japhia and Holly's work is a giant advance. Thank you. So we are just delighted to hear everything that you guys have accomplished and all the resources that you're sharing with this group. And there's been you really stimulated some great conversation in the chat as well, where people have been sharing other wonderful resources. So I encourage everyone to look there. Some resources around creating quality improvement projects around climate change, and how to get the graduate medical education coordinating bodies to support this work. So thank you so much. I'll go ahead and open it up if people want to unmute themselves and ask questions.
I'll just throw in at the end, Japhia and I are happy to communicate with anybody by email, and I think those were posted. Our article is posted, and as well as some others, and Todd Sachs' connection to quality improvement projects is really stunning, and that's also in the chat now. So
I have a question, Holly. I'm down here in Florida, and one problem we're only starting to recognize is in a sense, the air pollution from algal blooms, and the fact that there's a very significant amount of neurotoxins, some of which are not well characterized.
right.
I was wondering if you had partnered with any of the oceans groups to go into that further.
That's a great question. And I'll tell you, we definitely, in fact, in one of our other talks, when we do some didactics, we talk about algal blooms and the neurotoxins and the profound impact it had on the economic impact it's had on Florida with the red blooms and so forth. But anyway, we have not done that specifically. And that's exactly the kind of thing that we would love to partner with somebody to work on that. That's exactly the kind of collaboration we're looking for today. If we would love to develop like a standardized patient case, for example, for you guys to a patient presenting with neurotoxicity or eruptions, or somebody who's depressed because they've lost their whole recreational business because of the algal blooms, but then to take it to the next step, and how would you present these algal bloom problems with a policymaker? So we haven't partnered with anybody, but I can see that as being a phenomenal project, and we'd love to do it.
Thank you. I believe that Claude Burstall has his hand raised. Do you have a question?
I have a comment and question. This is David.
Sorry,
Pollock.
that was me who asked the last question. I didn't put my hand
Oh,
down.
great. Okay. Thank you. David, go ahead.
Sure. So I'm David Pollock. I'm from Oregon Health and Science University. We've been doing a lot of curriculum development too, but one of the biggest challenges we've run into that would be formidable in terms of trying to do what you all have done at University of Illinois is faculty development. We have a number of faculty who are interested, but we have not figured out a way to expand and incorporate more faculty to do the kinds of things that you've been able to do there. If you could comment on that, I'd appreciate it.
Holly, can you unmute yourself? And
So I would say that we did two things as a foray into this. One was in our own institution, we actually, and it was we were sort of beta testing the whole approach of having people write these case scenarios, because that was the springboard for having them think about and make the connections. That was what, the premise is that people are not making the connections, and we want people to make the connections. So we actually had also beta tested, we didn't mention this, but we had also beta tested with faculty and found that faculty were really receptive to that concept. And they had, this was different faculty, OB-GYN and pediatrics. And that got them thinking, well, maybe we should be doing this in our own specialty. So that was, and we didn't set out with the intent that, we're gonna, this is our way of engage, it was sort of a beta test, but it really turned out to be a way of getting faculty to think about, first of all, think about climate change, and that this way they could kind of insert it into their own pediatric curriculum. And the other thing is, when we actually ran our OSCE, I'm not the faculty that oversees the internal medicine OSCEs. So we had to write those faculty debrief guides and provided it to the faculty. So we did the work, but the faculty, once they got it. And so they were engaged, and the students and the faculty engaged in really robust discussions. And I think that's the springboard and the momentum to keep moving forward.
I'm just going to reinforce it. So I actually do help deploy the OSCE, and so we did that legwork of putting together the faculty debrief, which was not terribly complicated. One of the things keeping up with, for example, there's new asthma guidelines, so we've had to update that. But once we did that, and then we gave it to them, I think of a handful of people, they really they embraced it. So I think having done that, a little bit of that pre-work, we helped. But it is a challenge we have a limited faculties. We are a small satellite out in central Illinois, and so we don't have a huge amount of faculty. So indeed it is, but I think handing them the materials we're offering to help maybe author an OSCE, you get a few dedicated people. If you can kind of give them those tools, and they can take it to the next level. I hope that answered it. It's hard. It's very challenging. That was one of our biggest challenges, the faculty buy-in. But they bought in and just getting them to embrace it all.
We have time for one more question from the group.
Well, okay, I'll ask another one then. Isn't the biggest medical risk with climate change just heat stroke? And I know that, having been a biker before, I often, not often, but I sometimes rode to the point where I had heat stroke and didn't recognize it. That's going to become an increasing problem, not only for athletes, but obviously for the elderly.
So I'm gonna jump in right here, and I'll Japhia too. I think heat's the overarching problem, but because of heat, we have stagnant air, and because of heat, we have changes in our vectors and our host migration. Because of heat and changes in climate, we have extreme weather. So yes, it's funny. I can think of again another presentation where we talk about the direct impacts of heat stroke, heat-related illness, heat stress, but heat is the mother of numerous other things. And sometimes it's subtle. And when Japhia was talking about making the connections, if somebody comes in with depression because they've had profound loss and grief, because they've lost everything to extreme storms, well, our storms are much more extreme because of the air, the air holds a lot more water and so forth. So I think, yes, the direct impacts of heat are severe, but I think that's the connection we're trying to make, is that there's so many subtle things. And our medical student that you talked about, they didn't make the connection between climate change and they're asthmatic. No, it's not heat that's causing asthma, but it's heat that's making the air more stagnant, and that the emissions are making the air worse. And so I think it's a broader, Japhia, maybe you can add to that. Well, you're muted.
So you were thinking maybe about writing a case specifically about heat. Was that your question?
Well, I think that there should be a case study about heat stroke and the awareness that heat stroke and humidity are closely intertwined, and that you can have heat stroke and heat stroke deaths when it's only 94 degrees if the humidity is high enough.
Oh, absolutely. As we said, we're kind of limited in faculty and time, and also the number of OSCEs that we can run. So we chose the wildfire and asthma. But now that you said it, that's a great idea. We could totally write a case about somebody because we have a lot of cyclists, including my husband, who like to bike in central Illinois, and heat is a problem, especially with the humidity. Everybody goes, it's not the heat, it's the humidity. That would be a perfect case to write. So, if I can get the time, get one more OSCE in, I would totally write that case.
Well, it looks like that's our next step.
I would like to suggest, this is Robin Cooper. I'm in San Francisco and also a part of Climate Psychiatry Alliance. I would suggest that there are many, many cases like the extreme heat one that's just been identified that many of us probably have on our desktops or whatever. I've written a number of case scenarios. I'm wondering how we can join together so that you two are not doing all the case scenarios. Many of us may be able to contribute and have a repository that we can use then in our institutions together.
Yes.
And I just want to suggest that maybe that would be a step. And I would also respond maybe to David Pollock's suggesting that part of the difficulty is getting faculty to put this in their curriculum, that training medical students to advocate within their own institutions, to the leaders of the institutions, to put some pressure on incorporating this more systemically in the curriculum is also another place for advocacy.
Fabulous idea. And I think there's a lot of interest in that. And the consortium would be happy to help play a role in that. And I think that's a great next step for this session. So many great ideas. Thank you, Holly and Japhia, for being the vanguard on this and putting so many wonderful cases already into practice. There's lots of great conversation in the chat. Holly and Japhia, I encourage you to answer some questions directly in the chat if you have time, and then look forward to seeing this effort bloom with everyone here today. So thank you so much for your time.
Thanks, everybody.
Great.